Hi, welcome friends for today's session on NABH 637 AAC7, which is stating that the safety of the laboratory and the quality assurance program. So there is an established laboratory quality assurance and safety program should be there, which is included the laboratory quality assurance program to be implemented. The program should have the quality of the test results through the internal quality control, and they should have the external quality assurance. Then the program should address the clinico-pathological meeting, laboratory safety program. Laboratories personnel are appropriately trained in the safe practices, and the laboratory personnel are provided with the safety measures. Let us see, the laboratory quality assurance program is implemented. So labs should have one documented quality assurance program, which should include the POCT, point of care testing, pre-post analytical phase of testing cycle, IQAS, EQAS, feedback mechanism for patient at least yearly once, verification and validation of test methods, periodic calibration and maintenance of the equipment, incidents reporting with corrective and preventive action. So these are the things one quality, like a quality assurance manual, like they can prepare and they can include all the points in that. So the point should cover how you are going to conduct, like pre post analytical phase of testing cycle. What is the pre analytical phase, what is the post analytical phase, what is the analytical phase, how you are going to conduct for the all test. And IQAS, how many tests you have the IQAS, how many tests you have the EQAS, wherever the EQAS is not there, how you are going to do the quality assurance. So that everything in detail should be mentioned in your lab manual, lab quality assurance program. So feedback mechanism for patients, so feedback form should be prepared related to the collection of the sample, testing of the sample, testing result, then your reporting time, reporting result, everything should be covered in the questionnaires. And you should collect the lab feedback at least yearly once. This that should be collected. Verification and validation of the test methods, so all the verification, all the tests should be very validated, and like quality control should be run for all the equipments every day. Then you can run your samples as per the requirement. And the thing, for the further verification you can refer to the NABL 112, so where it is been detailing, because lab is having the NABL accreditation. NABH during also lab will be questioned. NABL accreditation is the fully accreditation for the lab. Periodic calibration and maintenance of equipment, so periodic calibration and maintenance of the equipment, all the equipment is required. So some equipment is required 6 month calibration, some equipment required 1 year calibration, so that needs to be defined in the manual. And preventive maintenance, all equipment should undergo the preventive maintenance of 6 months. Some company is providing, some hospital side will do. Incident reporting system should be there in the lab. All staff should be trained in the incident reporting system. Wherever anything will go wrong, like any test control has failed or any report has wrongly reported to the patient, any sample has gone for the redos because the sample has been failed, or the sampling technique is not correct. So these are the things should be raised, the incident or any system failure or any equipment failure. So that should be reported as incident, corrective preventive action should be taken, and that should be documented. The program ensure the quality of test result through internal quality control. So equals needs to be done for all the tests for quality reporting. If more than one measuring system is used, then test comparison needs to be done. You can refer to the NABL 112. For the external quality assurance and proficiency test, for all tests, EQUAS and PT needs to be done. Some test the EQUAS and PT is not available, so that should be done through the quality assurance by alternative method, like sample can send to the other lab for the testing and you can compare the result, or you can replicate the testing by split sample within the lab. The program address the clinico-pathological meeting. So clinico-pathological meeting is the important to discuss the histopathology reports, correlation of the histopathology report. So all correlated histopathology and non-correlated histopathology reports to be discussed in the clinical pathology meeting, and all the clinicians should be the member of the clinical pathology meeting. Clinicians, like, you can choose every clinician to can't be the member of the meeting, but you can choose the department wise at least one clinician should be there in the meeting. So the clinician, with the clinician you can discuss the non-correlated reports. Then the labs should define the interval, how many months you are going to conduct, what is the requirement. So you can conduct the meeting quarterly once, but it should be conducted. TOR needs to be prepared, terms of reference to be there for the meeting. Terms of reference mean you should write the what is the purpose of the meeting scope, then you should write the who are the chairperson of the meeting, then member of the meeting, then what is the role of the members, then what is the discussion you are going to do, discussion points, agenda in the clinical pathology meeting, then how frequency it should be done, what is the your how many members is the mandatory to be present. So that also needs to be defined in your terms of reference. So member needs to be decided, all the clinicians should be the member, and all histopathology report for the correlation is to be discussed. Laboratory safety program is implemented, so the documented policy should be there for the laboratory safety program, and it should be the part of organization safety also. So laboratory safety program should include the safety of equipment, employee safety, lab safety, HIRA, MSDS, disinfection protocol, biomedical waste management, everything should be written in the laboratory safety manual. Laboratory personnel should be appropriately trained in the safety practices. All staff should undergo the training for the safety practices, how to handle the sample, how to run the sample, how to collect sample, how to transfer. Everything should be, the safe practice should be trained to the staff. If they are getting uh, interacted to any chemical, or any chemical spill to their eyes, so how they will act on that, so that at all should be trained to the staff. All new joinings should have their departmental induction, and the safety uh, practices should be trained. All staff should be trained on the MSDS. MSDS is what? MSDS material safety data set, which is the, in which it has been written the what is which chemical, how to be transported, where to be stored, what is the storage criteria, transport criteria, if anywhere spill, then how you are going to clean that area, and if you are you are coming interact with that chemical, then or you are if the chemical is poured in your body or eyes or anywhere, what you will do, how you will wash. So that is the MSDS. HR training records should have for all the staff in their employee file. So whatever the departmental training given to the staff, that should be there in the personal file of the employee. Laboratory personnel are provided with appropriate safety measures. All staff should be immunized. All staff should have the proper PPE, should be audited on the safety precaution on is a quality parameter. So we have the KPI, safety precaution audit. So safety precaution audit should be done for all the staff. So it should be done on the sample based. So the sample how needs to be calculated, whatever, if your total employee of the lab is 30, so 30 employee is working for 25 days, so 30 multiplied by 25, so you have to be calculated from the 750. So 750 is your sample size. From there you have to calculate your sample size. Your total employee will be 750, so sample size you have to calculate as per the NABH sample criteria, or else you can take the 10% if it is more. So anything you can do the random or stratified sample size calculations, so you can calculate the sample and you have to do the audit as per that. And IUOSR should be provided in the lab for the any ice spill if happen, any chemical spill to the ice, so they can wash their ice immediately. So all safety measures like fire extinguisher, chemical storage place should be there to proper for the safety practices. So thank you. This is all regarding the quality assurance and safety of the lab. So if any anything you required more information, then just do the comment. I'll reply on that. Thank you.